name's Hannah Silverthorne, and I'll be showing you today how to perform the Schirmer tear test. I will run this test alongside an IOP and the fluorescein dye test, as they are all part of a comprehensive eye exam. The main reason for performing the Schirmer tear test is because it measures the tear production of each eye. In a clinic setting at school, we will only do one eye because the other student will get a chance to do the other eye, but in clinical settings, I will do both eyes to get a measurement on both of them. This test can help aid in the diagnosis of KCS, also known as keratoconjunctiva sicca or dry eye. Some clinical signs you'll see in the dogs is redness, discharge, excessive blinking, squinting, and just overall pain with the eye. This is my patient Scarlett. If she were a bit more rambunctious or anxious, she could get a sedative, but we would avoid using acepromazine as it causes a third eyelid protrusion. Although this test can be done on calm patients rather easily. So to start, I'm going to look in her patient file and just be sure that she hasn't had this procedure done before, or if she has, I'm going to compare my notes to the last one. Okay, she has not had this procedure done before. So the first thing that I'm going to do is put on some gloves. I will make sure that I have no drops in her eye, and I will take my little piece of gauze and wipe the eyes out, making sure that there's no discharge left in the eye. I will then take my test strip and bend it at a 90-degree angle. It is important that it stays in the paper, as this is a sterile tip that is going into the eye, so we have to make sure it stays at a 90-degree angle, as we're going to put it into the lower eyelid. So I will then open it. And you can see that my tip is at a 90-degree angle, and I will be sure not to touch it. This is where I will be placing the eye in the lower eyelid. Just under there. And I'll put it in just like that, just so it's under the lower eyelid. And I'm going to make sure it stays under the eyelid, and I will leave it there for 1 minute. After the 1 minute, you should, even before, you should start to see the tear flow production happen onto the strip. And then it will give me a measurement on my scale at how high or low her tear production is. So the normal range for dogs is 18 to 25 millimeters of moisture. If Scarlett were to have KCS, she would have a measurement of less than 15 millimeters of moisture. If she were a feline, she would have less than 10 millimeters of moisture. And if she were to have dry eyes, some of the treatments that we can do for her are give artificial tears, also known as Optimum. That's a really good one to use. You could also use a lubricant, or you could use antibiotics or steroids. That would help to increase the tear production as well and keep infections away. After all of this, I'm going to write down my findings in her patient chart. I'm also going to alert the doctor if I find something abnormal, or I will just let him know if I find something, if she's normal as well, and then I will let the clients know and do whatever I'm told to do next. Afterward, I will take my gloves off, and I will throw them all out in the garbage along with the test strip. Thank you very much for listening how to do the Schirmer tear test.